Welcome, everyone. We're going to get started in just a minute or two. While everybody comes into the room, you can enjoy looking at that great white coat photo that you took with Dean Page. Welcome, everyone. We'll get started in just a minute. In the meantime, you can enjoy your white coat photo that you took with Dean Page. Okay, it looks like we'll go ahead and get started. So as I said, welcome everybody. And for family and friends of the class of 2024 who may not know me, my name is Karen Lansbury and I'm the director of the Foundations curriculum for the Lorna College of Medicine. And to the class of 2024, let me be the first to congratulate you on your accomplishments thus far. And you finished the foundations level of medical school. Congratulations. So the faculty and staff have done their best to guide you through your learning, and some of them will be receiving awards today, but I want to point out that we're very grateful to all of them for their service and devotion to your medical school education. But it's really the students who did the work, challenged yourselves, and have persevered to have accomplished this important leap towards becoming physicians. It's important to acknowledge within yourselves that you have reached this goal, and importantly, to reflect on how this goal is connected to your broader purpose. As you move into clerkship and beyond, if you set authentic and achievable goals that contribute to the development of your broader purpose, you'll be able to better follow your individual paths to a fulfilling career. Congratulations to all of our nominees and awardees for their contributions and achievements. And before I turn it over to Dean Page, I'd like to give special thanks to those who helped organize this event, especially Liz Dorman from the communications team and Susan Thompson from the OME team. And even though you'll be moving into clerkship and I won't be involved in your day-to-day curriculum anymore, please know that I care about every single one of you, and I'll still be here cheering you on. And if you see me in the hallways, please stop me to say hi and let me know how you're doing. But with that, I'd like to introduce the Dean of the Lorna College of Medicine, Dr. Rick Page.
Thank you so much, Dr. Lansbury, and welcome to all the students and faculty and friends who have gathered together online this afternoon, especially members of the class of 2024. I want to congratulate the class of 2024, and that's the first time I've seen that picture, and it's really special. I appreciate the opportunity to have that white coat photo a little bit later than usual. You have the distinction of being the first class in 100 years to begin your medical education in the midst of a pandemic. None of us anticipated a first day of school like you had, and I certainly never expected us to be using Zoom and wearing masks for so long, but here we are. Thank you for your resilience. I also want to thank the medical education team along with our very accomplished ComAV staff for putting together today's event. Greeting you today, I can't help but think back to your white coat ceremony 15 months ago. It was different from everyone that came before, but still profoundly meaningful. As I said that day, the symbols and ceremonies and oaths we take are reminders of the covenant we enter into when we pursue a career in medicine. In the coming months, you'll get to wear your white coat on a daily basis as you undertake your clinical training and become that much closer to becoming a physician. This will be an exciting time where you'll get to experience different specialties and sort out the direction your career will take. As you do so, I ask you to continue to embrace our statement on professionalism, our true north. Every patient deserves our cultural humility, kindness, and respect, along with the commitment to being the very best physician we can be. Before you take that next step into clerkships, it's fitting to consider where you've been and how you've arrived where you are at this very moment. Today's celebration is so meaningful because it demonstrates and honors the relationship between you, our students, with our faculty and staff. I'm very happy to join you at this significant milestone in your medical education. I want to congratulate all of the members of the class of 2024. I know you will be up to the challenge of clerkships as you head out to serve patients in Vermont and Connecticut and beyond. Now it's my pleasure to introduce a very familiar face to you, Interim Assistant Dean for Students, Dr. Lee Rosen.
Thank you so much, Dean Page. This is such a pleasure to be here for this event. You are a very special class to me in a couple of ways. One is that, as Dean Page noted, that you have had foundations. You've made it through a COVID shrouded foundations, and that is. Foundations is always a significant accomplishment. You did it under adversity, and your class, I think, has done it with, to me, noteworthy grace and professionalism. And one of the modes of professionalism that makes me most proud of you is how well you've taken care of each other during this time. And that is that's something that I think is extremely important to us and will serve you well throughout your career. And it highlights in some ways what, one of the other reasons this is my favorite transition, because you go from, in some ways, being quite focused on yourselves, your learning, your exams, passing, getting through, making the transition to medical school, to the clinical level. And in the clinical level, the focus shifts to taking care of other people. And when your life becomes about taking care of other people, especially people at the height of their suffering, I think what you're going to learn soon is that there's nothing that is more gratifying and fulfilling than that. And every time we get to see you make that transition to that being the center of your life, it's extremely gratifying and fulfilling for us. So really looking forward to watching you emerge to the next chapter. So with that, I will introduce our first student speaker here, excellent second year student council representative, Warwick Sahini, who it's been my great pleasure to get to know and work with as a student leader. Warwick, I'll throw it to you.
Thanks, Dean Rosen. Class of 2024, I want to take a moment for us to recognize the milestone we have achieved in completing our foundation's requirements. Take another moment to realize not long ago, a lot of us met one another in a time where we only saw a portion of someone's face. Many of you moved across the country and across the world to begin your medical education. I remember attending a Jumpstart Vic outdoor event and thinking to myself, how will I get used to socializing and learning in these conditions? Not long after, we entered our first semester of medical school in a hybridized format as our first experience, and we survived. It wasn't easy adapting to COVID testing changes, virtual clinical skills exams, and even a portion of focus being completely remote. But we survived. A year later, we have completed our preclinical education, as today marked our last commitment of convergence. For many of us, this is the last time we will have formalized classroom instruction. I'm very excited for all of us to begin the next chapter of our learning, whether that is in the halls of Baird 6 at our main hospital here, or in the 2 hospitals in Connecticut in the operating room. We have been instructed since preschool through high school, college, additional degrees, career changes, and today we have finished, at least partially. As we begin our official dedicated study period, I would like to take a moment to share some advice I received from a resident and friend of mine, Dr. Cam Henry. Your dedicated study period is a time in your life where you will learn so many details, fun facts, diseases, treatments, and much more about medicine that you may never have the opportunity to learn about again. Use this period to grow your mental library about medicine and try to enjoy the experience. Finally, as we embark on this next challenge, remember to give yourselves a break from time to time. Call your friends and family, exercise, go buy a large pizza and devour it in one sitting if you must. We've earned it. So as a class, please join me in a round of applause to thank everyone who has dedicated their time to advancing our medical education. I'd like to turn it over to Dr. Lansbury.
Thank you, Warwick. So in the last few weeks, the class of 2024, the faculty voted for faculty, staff, and standardized patients and fellow students who they felt had a number of qualities that make them invaluable leaders and teachers. And to kick off our awards from the class portion of the program, please welcome Sydney Cardozo to present our first student selected award.
Hi, everyone. On behalf of the leaders of the American Medical Women's Association Affinity Group, I'm pleased to present the Amwa Gender Equity Award. This award honors a faculty member who promotes a gender-fair environment for the education and training of physicians and gender diversity in the field. The nominees for this award are Lyanna Burgess, Jenna Emerson, Evan Eiler, Anya Kutras, Joseph Rivera, and Rebecca Wilcox. On behalf of Amwa and the class of 2024, we are pleased to present this award to Dr. Lyanna Burgess. Our class has had many wonderful things to say about Dr. Burgess, and here are some of the comments. Dr. Burgess is a role model for women entering medicine. Phenomenal course director and instructor. Beyond that, Dr. Burgess is so personable. She knew and conversed with students and knew them by name. Dr. Burgess is so respected and admired across the medical school and the hospital and is a phenomenal doctor. Great professor, kind, patient, understanding. And then I think this sums it up the best. Dr. Burgess is the best. Congratulations, Dr. Burgess. I couldn't agree more with all of these comments. And now I'd like to send it over to my dear classmate, Elise to present the next two awards.
Thank you so much, Sydney. Standardized patients play an integral role in the education of Larner College of Medicine medical students. They foster an environment in which students can practice interviewing and examination skills and receive honest feedback. The ability of a physician to develop rapport with a patient, perform a focused examination, and gather an accurate history are vital skills that Larner College of Medicine students are fortunate to practice early and often. The standardized patients share their experience, knowledge, and time with students during both foundations and clerkship years. Due to the tremendous role they play in the curriculum, we would like to recognize the devotion of our standardized patients. The criteria for nomination for the award are effective teaching of clinical exam skills, providing the best constructive feedback, and creating a positive learning environment by being consistently excited and engaged in medical student education. We are pleased to announce the nominees for the Outstanding Standardized Patient Award this year are Lois Cassavant, Nicole DeLisa, Christopher Hill, Vivian Jordan, Peter Kurth, Deb Lyons, and Julie Mitchell. The class of 2024 has voted to honor Nicole DeLisa with the Standardized Patient Award. Here are some of the things our classmates said about Nicole. Nicole is incredible at providing seemingly real patient encounters. She always fully immerses herself in the role she is playing. She also gives excellent constructive feedback, and I always find my encounters with her to be very valuable learning experiences. Nicole is awesome. Even via Zoom, Nicole taught me a lot about how to be considerate of the human element of medicine, and that HPI and physical exams are much more than just asking the required questions in the appropriate order. Nicole is fantastic in ensuring that we are able to learn as many clinical skills as possible. She's a fantastic teacher, a true chameleon for different patient presentations, and just a wonderful all-around presence in what can easily be an awkward situation. Congratulations, Nicole. Next is the Outstanding Teaching Assistant Award. This award recognizes the TA who was the most helpful in teaching and facilitating within a foundations course. The nominees for this award are Nurin Damji, Emma Levine, Michelle Oberding, Ashley Peterson, PJ Tren. The class of 2024 has voted to honor Ashley Peterson. Some comments from the class of 2024 about Ashley. It was clear that Ashley knew exactly what she was talking about and put a lot of preparation into her review sessions in CRR. I knew I could ask her almost any question and get a straightforward, concise, and trustworthy response. She was also the most active and engaged TA during our class sessions. Ashley was fantastic in making sure we actually understood subject content. Her comprehensive knowledge of the subject matter was clear, but what stuck out to me the most was how she stuck around with us until she knew we got the concept she was explaining. Ashley ran very helpful review sessions, and what was especially helpful was that she went to each table during class to help us with questions. She was a terrific TA. She knew everything and gave us everything she knew. I thought Ashley was a great TA. She cared about the students. Congratulations, Ashley. Next up to present is fellow class of 2024 member Josh Cohen.
Thanks so much, Elise. Hi, everyone. Congratulations on achieving this huge milestone. I'd like to begin by presenting the Best Support Staff Award. This award recognizes the staff member who best supported students in areas outside teaching and the typical classroom setting. The nominees for this award are Michelle Bookless, Matt Bresler, Nick Lemon, Tim Moynihan, Julia O'Connor, Kara Simon, and Kirsten Palquist Tavares. The class of 2024 has voted to honor Dr. Tim Moynihan. Here are some of the things our class had to say about Dr. Moynihan. Tim has given me multiple tutors, multiple support meetings, and encouragement throughout school. Tim is the best. He has helped me navigate step studying, and I feel a lot better and less anxious after talking through things with him. Dr. Moynihan is very patient and takes time to really listen to our concerns. He is quick and responsive. I appreciate all the time you put into both providing resources and being available for us. Dr. Moynihan, thank you for all the incredibly hard work you have done behind the scenes to make our medical education so successful. Congratulations on this award. Next, I am also proud to present the Silver Stethoscope Award. This award recognizes a faculty member who, despite having few teaching hours, made a substantial contribution to advancing student education outcomes. The nominees for this award are Dr. James Boyd, Dr. Mark Charlson, Dr. Joanna Conant, Dr. Pamela Gibson, Dr. Matthew Gilbert, and Dr. Lauren McAfee. The class of 2024 has voted to honor Dr. Pam Gibson. Here's what our class had to say about Dr. Gibson. Histopathology would not be the same without Dr. Gibson. She made learning enjoyable and always made sure to bring a little bit of fun to her lectures. Dr. Gibson is a force to be reckoned with. Her knowledge and skill is so expansive, and she does a phenomenal job of teaching and transferring that to us. From pathology reviews to Gross Lab to teaching about nephrotic and nephritic syndrome, she is so organized and adept and teaches in a way that really solidifies information. Dr. Gibson did a great job wrapping up CRR. Attendance was high at her sessions, and I think this was largely because she was teaching high yield information in a way that was engaging, fun, and highly informative. Plus, she brought candy. She actively engaged students and was very clear in her teaching style. She made pathology more understandable and accessible for me. Dr. Gibson's enthusiasm was infectious. Even though she did not teach us often, she contributed significantly to my understanding of pathology. Dr. Gibson has more energy and passion than most. Her classes were fun and extremely informative. The kidney was a mysterious retroperitoneal organ until Dr. Gibson expertly guided us to our current understanding. Congratulations on this award, Dr. Gibson. I will now pass it over to Than Moore to present our next two awards.
Thanks, Josh. So first, I have the honor to present the Above and Beyond Award, which recognizes the faculty member who went above and beyond their call of duty to help students in their learning objectives. The nominees for this award include Drs. Lyanna Burgess, Pamela Gibson, Andy Hale, Bill Razga, and Joe Rivera. This year, the class of 2024 is happy to honor Dr. Andy Hale with this award. Dr. Hale, I'd like to share a couple words from our class. Dr. Hale far exceeds his role as course director, and this award should be named after him. He really went above and beyond to encourage and motivate us. CRR is typically recognized as one of the more challenging courses in second year. and he ensured that we never felt overwhelmed by providing multiple review opportunities and treated us with treats during those reviews. He encouraged community amongst us in inviting us to his home and on a lovely hike up Mount Philo. He knew us all by name and frequently interjected into class to make sure that we recognize the high yield topics, both for his class, for the exam, and our clinical careers to come. He was a phenomenal course director. Congratulations, Dr. Andy Hale. It's a pleasure to honor you with such an award. And next, I have the pleasure of announcing the Foundation's Teaching Award. This award is presented to the faculty member who provided the most outstanding teaching activities within the Foundation's curriculum. We are quite fortunate with the sheer amount of amazing teachers we have at the College of Medicine, and everyone nominated has both inspired and made us better off as we move into this next phase of our clerkships. The nominees for this award are Doctors Lyanna Burgess, Dr. D. Alberto, Pam Gibson, William Hopkins, Bill Raska, and Rebecca Wilcox. The class of 2024 has voted to present this award to Dr. Nicholas D. Alberto. Let me share some kind words that our classmates have written about Dr. D. Dr. D's material from Focus and Med Neuro somehow stuck with me. He really does a wonderful job explaining things clearly, using images thoughtfully, encouraging us to follow along and make connections. I remember when he taught us the ganglia and how he had us all take out our clipboards and paper and draw along. This super complicated system to me still feels totally understandable. In lab, he was constantly helping us make connections to things outside of what we're doing within the four walls of our laboratory. He is passionate about teaching. Dr. D made med neuroanatomy so much better than we all expected. Dr. D, I wish you congratulations. I can definitely say you've truly bettered my experiencing when navigating my way through this challenging material. And with that, I'd like to bring back for my classmate Warwick back to the podium to present the last two student selective awards.
Thanks, Dan. I'm pleased to present the Dean Warshaw Integration Award. This award is named after Dr. Joe Warshaw, former Dean of the UVM College of Medicine, now Larner College of Medicine, who championed the implementation of the Vermont Integrated Curriculum, the VIC. The award recognizes the faculty member whose teaching best captured the spirit of the VIC. The nominees for this year's award are Lyanna Burgess, Joanna Conant, Nicholas D. Alberto, Pamela Gibson, Andrew Hale, and William Raska. This year's award goes to Dr. William Raska. The best way to capture what Dr. Raska means to the class of 2024 is to hear it in our classmates' own words. I'd like to take a moment and share some of these quotes from our class about Dr. Raska. Dr. Raska pretty much built the entire A&D class while also teaching most sessions. He embodies this award. I imagine it is very challenging to facilitate active learning in a course held fully over Zoom, but that is exactly what Dr. Raska did during A&D in 2021. He was passionate about making sure all students remained engaged and was never afraid to call out specific students to make sure they were involved. Dr. Raska was fundamental in establishing active learning as the cornerstone of our education. The structure of A&D made us work together to tease through problems and prepared us for what actual clinical practice will be like. Dr. Raska is incredible in the active learning environment. Though his cold calling can feel jarring, it is really effective at engaging students and preparing us for clerkships. Since A&D, I've gotten used to thinking about my answer to a question, even if I won't likely be called on. Congrats, Dr. Raska. Finally, I'd like to present the Outstanding Foundations Course Director Award. This award recognizes the Foundations Course Director who showed the highest degree of dedication to the successful design and implementation of their course curriculum. The nominees for this award are Lyanna Burgess, Andrew Hale, William Raska, John Steele Taylor. I'm pleased to present the Foundations Course Director Award to Dr. Andrew Hale. We've already heard some nice things about Dr. Hale. Here are a few more things our class said about you. Dr. Hale was overall and very effective and wonderful instructor and leader. Dr. Hale's course is the most organized, most clinically relevant, and most streamlined. CRR is a course full of high yield material that is all very interconnected, and Dr. Hale does a great job of making sure that it is taught in the most logical order with connections made to the previous material as is necessary. He was very receptive to student feedback and is highly motivated to make CRR even better each year. CRR was a tight ship, and we had Dr. Hale to thank for that. The complex material was presented in a thoughtful, comprehensive, and logical manner, and his contributions to the flow of the course were very clear. Easily the most organized and well thought of course in all of Foundations. Thank you for all the hard work. Next up, Dr. Lansbury will present our final faculty award and kick off the awards for our class of 2024.
Thank you, Warwick. Our last faculty award is our Curriculum Innovation Award. The recipient of this award is chosen by the Medical Education Leadership Team to acknowledge a faculty or staff member for their dedication to innovation and contributions that improve programmatic outcomes in our overall medical education curriculum. This year's awardee is Kate Nicholas, our Director of Simulation Education and Operations. Kate has been instrumental in adapting to the needs of curriculum experiences by creating new opportunities for our medical students to receive valuable training using simulation. She's worked closely with our course directors to provide online experiences when COVID restrictions prevented patient encounters. She's also been organizing longitudinal assessment rubrics for documenting clinical encounters in Foundations that will carry through to clerkship objectives. And these assessments will be critical as the curriculum moves towards more competency-based assessments. Kate has also met the challenge of creating diverse clinical experiences for students in Vermont by actively recruiting simulated patients from diverse backgrounds. Congratulations, Kate. We now move to the class of 2024 Foundation's Student Awards. Please join me in welcoming Wellness Committee member Ankrish Milne to present our first student awards today. To you, Ank.
Thanks, Dr. Lansbury. The Wellness Award for Peer Recognition is the only student award presented to another student at the Foundation's award ceremony. In an atmosphere that mainly rewards academic achievement, this award recognizes a peer-nominated individual who has been an asset to our classmates, displaying dedication to helping others during the course of our medical training. Now for the winner of the Wellness Award for Peer Recognition, Mia Lavina Exume, congratulations to you. Mia exemplifies the spirit of wellness by consistently encouraging her peers and maintaining a positive attitude in all situations. She is a dependable friend and a source of support, always taking the time to listen to fellow peers in need. Our classmates shared some comments about Mia's impact around ALCOM, saying the following: Mia's energy is contagious, and she has always been an incredibly positive impact on the learning environment. Mia is great, always one to welcome you with a smile and a compliment. Running into Mia always makes your day better. Mia has been crucial in our class's ability to bond during unprecedented times. Her warmth, openness, and overall great spirit has made ALCOM a more welcoming space for all of us, even though she hasn't worked in any official capacity here. I cannot imagine where our class would be without Mia's ground level input. She brings a light and a joy to everyone that she meets, and it's so easy to feel welcomed and comfortable around Mia. She is loving to every single person, a special quality that makes her a wonderful member of our class and someone I am lucky to call a friend. She has sent me messages when I'm feeling down or need to pick me up, and she's always thinking about the well-being of others and spreading positivity. And lastly, Mia has been such a source of wellness for me, a ray of light and a joy to be around. She is so supportive. She does a lot outside of the classroom, but is never too busy to be a friend and an ally. We could all learn from the way that Mia supports her ALCOM peers. So Mia, congratulations again, and thank you for all that you have added to our community. Next up is David Schneider, who will present the Cbri Summer Research Fellowship Merit Award.
Thank you. First off, I just want to add my congratulations to all of you for getting to this important step. I have the honor to be the director of the Cardiovascular Research Institute, and our key mission is actually to foster cardiovascular research. And a very important aspect of that is the nurturing the development of junior investigators. You are the next generation of scientific leaders and pivotal to the continuing excellence at UVM and elsewhere in cardiovascular research. For this reason, we support the summer research fellowships for first-year medical students who are interested in this. In addition, the Cbri provides a $1,000 award to what is judged to be the most meritorious cardiovascular research-related project. This year, the recipient is Ying Liu, who worked with Dr. Tim Plant on a project entitled Hypertension Severity as Quantified by Hypertensive Daily Dose and Risk of Stroke in Regards. Ying really did a great job. She joined a productive research team and was fully integrated. She examined the association between hypertension daily dose, which is a metric of the intensity of antihypertensive therapy, and the risk of stroke. Ying was able to work with a large database, which is the Regards trial. She had a great exposure to clinical epidemiology. Her positive exposure to research was a success unto itself. Her research demonstrated that among patients who remained hypertensive, defined as a systolic blood pressure greater than 140, a greater hypertensive daily dose was associated with an increased risk of stroke. All of the summer research projects with cardiovascular focus were evaluated by our early career advisory committee. Although this encompassed many meritorious projects, Ying Liu was selected for this award. On behalf of the early career advisory committee and the board of the Cbri, I congratulate Ying and hope that this experience would be just the first step in a career focused on research to advance the care of patients with cardiovascular disease. Next up, I'll hand this to Dr. Renee Stapleton.
Hi, everyone. Thank you very much, Dr. Schneider. I have the honor of serving as the Director of Medical Student Research, so I get to witness an immense amount of research project progress from every class. Over the past more than a decade, student participation in research at LCOM has grown steadily to the point that it's almost overwhelming. In the summer of 2020, we had over 40 students conducting summer research, which was a new record. So that's amazing. Before I announce the awardees, there are 4 really important groups of people who make student research possible that need to be thanked. First of all, the wonderful faculty mentors who welcome students into their research groups and their labs and provide all the guidance and inspiration and financial support to make this possible. Secondly, the college for supporting the students' work with stipends. Third, the Medical Student Research Committee members for their dedication and kind of tireless hard work evaluating all the applications and reports on an ongoing basis. And then finally, to all of you, the students themselves, who are putting their hearts and souls into generating new knowledge and getting this important firsthand experience. Along with the number of students doing research every year, all of the members on the research committee remark every year when we do this that the quality seems to be increasing over time, and it becomes more and more difficult every year to choose merit awardees. I'd also like to note that it's very common for members of the Medical Student Research Committee to have students working with them themselves. And we specifically recuse ourselves from evaluating applications from the students with whom we have a conflict. So after much deliberation, the following 3 awardees were selected, each of whom will receive $500. These projects were amazing. The students immersed themselves in the project, were very independent with the work, developed their writing skills, and in a lot of cases, their statistical skills, and really handled a lot of the work on their own. So the first awardee is Sam Afshari. The title of that project is Trends and Outcomes of Salvage Lobectomy for Early Stage Non-Small Cell Lung Cancer. And the mentor is Dr. Nat Lester-Cole in radiation oncology. The second awardee is Amanda Gallancamp. The title of her project is Post-Hospitalization Rehabilitation Participation and Outcomes Among ICU Survivors in Vermont. I was very lucky to have Amanda as one of the students that I worked with this last summer. And she also had a lot of mentorship from Adam Atherley, from doctors Adam Atherley and Andrew Wilcox. And the three of us worked together with Amanda, which was an amazing experience. And the third awardee is Molly Mepions. The title of her project is The Effective Pregnancy and Preeclampsia on Brain Oxidative Stress and Endothelial Activation After Stroke, Relationship to Infarct. Her mentor is Dr. Marilyn Sapola. So congratulations to all of the students on their research, very commendable work. It's such a pleasure to watch you. And a special congratulations to these three Merit Award winners for your wonderful projects. Great work. Now you'll hear from Dr. Rebecca Wilcox, who will present the Wohl Award for Excellence in General Pathology.
Thank you, Dr. Stapleton. We really, our department appreciates this opportunity to award this year's recipient of the Efron Wohl Award for Excellence in Pathology. A little bit about Efron Wohl. He was born in Russia in 1911 and he became a US citizen in 1932. He graduated from Creighton Medical School and after a little stint at Harvard, he came to the University of Vermont where he academically progressed, eventually serving as the acting chairman of the Department of Pathology. An interesting connection is after leaving University of Vermont, he was appointed director of laboratories at Danbury Hospital in Danbury, Connecticut in the late 50s, where he spearheaded this movement, which really modernized the Department of Pathology. An in memoriam published in the American Journal of Clinical Pathology at the time of his death noted that, quote, he was a teacher in the best classical tradition with an uncanny ability to stimulate the minds and scientific curiosity of his students. So in honor of Dr. Wohl, this award is given annually to the student that demonstrates outstanding performance in foundational courses in general and application of pathology, including histology and pathology tagged content. So this year we are thrilled to recognize Max Hodwells as this year's recipient of the Efron Wohl Award for Excellence in Pathology. Next up is Shirley Mcadams to present the Clinical Exam Skills Award.
Thank you, Dr. Wilcox. The Exemplary Clinical Skills Award recognizes the students who have best demonstrated outstanding clinical skills throughout the Foundation's curriculum. It celebrates the history of Lorna College of Medicine's commitment to patient-centered care, and it embodies the significance of medical simulation. Our students learned from over 60 standardized patients aged 3 months to 80 plus years old, and experienced 56 simulated clinical encounters during Foundation, and more than 94 simulated clinical encounters before graduation. In order to receive this award, a student must demonstrate excellence across all domains of assessment, including professionalism, communication, medical interviewing, and physical exam. The 5 recipients of the Exemplary Clinical Skills are, in alphabetical order, Nick Burnett, Taylor Drake, Morgan Howlett, Colleen McCarthy, and Louisa Moore. Congratulations to all of you. And now I'll turn it over to Dr. Lansbury to present our final 3 awards.
Thank you, Shirley. So the first Foundation Student Achievement Award is the B. Albert Ring MD Memorial Grant Fund. This fund was created in 1989 by family and friends of Dr. Ring to provide financial support for deserving students at the Lorna College of Medicine. The fund was established to honor Dr. Ring as a respected teacher of medical students. Dr. Ring was a faculty member in the Department of Radiology and a pioneer in the development of neuroradiology. He was very active in teaching clinical correlation sessions in the original Department of Anatomy and Neurobiology. The students selected must exemplify the many fine human qualities possessed by Dr. Ring, including compassion, humor, humility, devotion to family and friends, and intellectual curiosity. The candidates are selected by the Lorna College of Medicine teaching faculty in the Department of Neurological Sciences and faculty in the Office of Medical Student Education. At the time the fund was established, the donors indicated a hope that in some future time in their careers, the winners of this award will contribute to the fund for the benefit of future medical students. This year's winners of the B. Albert Ring MD Memorial Grant Award are Elliot Binkard-Dale, Stephen Halsey, Amanda Natras, and Sean Taylor. The next award is the Derwood Smith Award for Excellence in Pharmacology, which is named in honor of Dr. Derwood J. Smith, former chair of the Pharmacology Department from 1953 to 1975. Dr. Smith was committed to furthering the understanding of the physiological and biochemical basis for use of drugs in clinical medicine. He was keenly interested in the emerging discipline of clinical pharmacology and was instrumental in developing this field at UVM. This honor is awarded to a second-year medical student with the highest aggregate score in the foundation's courses that have major pharmacologic content. This achievement acknowledges the importance of applying pharmacologic principles to the treatment of patients. And this year, the recipient of the Derwood Smith Award for Excellence in Pharmacology is Sydney Cardozo. Congratulations. And our last award for today is the Wasserman 4+ Prize. In 1988, Henry Wasserman, MD of 51, and his wife Phyllis established a scholarship prize to be awarded annually to the students who had demonstrated outstanding scholastic achievement in the foundation's portion of their education. The winner of the Helen and Phyllis Wasserman 4+ Prize this year are Nicholas Brunette, Colleen McCarthy, and Rachel Wayne. Congratulations. So congratulations to all our faculty, staff, and students on your awards. And now I'd like to introduce Dr. Elise Everett, the level director of the clinical clerkships, to welcome you.
Thank you, Dr. Lansbury. It's my pleasure to welcome the class of 2024 to the clinical clerkship year of your medical school experience at the Larner College of Medicine at the University of Vermont. I'm going to keep my remarks short and personal. My name is Elise Everett, and my short bio is that I'm a gynecologic oncologist, a passionate medical educator, and a fierce hockey mom. Go Cougar Hawks. I'm the level director for clinical clerkships, which means I'm your next Karen Lansbury. I began this position 1 week before the pandemic in March of 2020, so I've yet to experience a non-pandemic clerkship year. So I'm very hopeful that the class of 2024 may be the first. As I went to write these remarks, I remember the moment I decided on my own career path. I was at an outreach OBGYN clinic in Spokane, Washington, on my very last clerkship rotation. A gynecologic oncologist from Seattle had come to our site for the day to see patients. I spent the day in awe of this physician's rapport with patients, her surgical acumen, her clinical judgment, and she was an athlete, a musician, a wife, and a mom too. From that moment on, I had my mentor, I had my vision, and I set out on my journey to find my professional identity. Medicine changes you. As I write this here today, I think I have been successful, and I hope that each of you will have an amazing professional journey, and I am so honored to share a portion of that with you. Personally, I think the biggest challenge for medical students as they transition from the foundations level to the clerkship level is understanding that as a medical student, you are no longer at the center. The patient is at the center, and the system revolves around the patient's needs. This is the calling of medicine, always putting the patient first and dedicating yourself to a life of service to others. I hate to break this to you, but you've just completed the science part of the curriculum, and that's the easy part. You're about to embark on the hardest year of the four-year curriculum. Clerkship year is hard. The long hours, the fatigue, the stressors, the high expectations, the constantly changing landscape from clinic to inpatient to the operating room, and the need for adaptability and flexibility. This is a marathon, not a sprint, and there is no finish line, just a circular process of learning, of improving, and growing. The secret to thriving in medicine is finding joy and passion in the everyday work of caring for patients. This is not about work-life balance, but more about work-life integration. Being a doctor is not a job, it is a part of who you are. In clerkship, you are going to see how the foundational sciences apply to each individual patient and discover that the art of medicine is a lot more challenging. Medicine is not a single right answer on a multiple choice test, but rather each patient has a unique right answer for themselves. And more often than not, there's not a right answer, but rather the right answer for that patient at that particular moment in time. This uncertainty can be disorienting. However, if you always put your patients first, you can never be wrong. Your world is about to get a lot bigger, and the emotions and stressors you are going to experience are going to be beyond your imagination. You're going to discover the calling of medicine, the privilege, the honor it is to participate in patients' lives in these enormous moments, the delivery of a baby, news of a cancer diagnosis, ringing the gong after finishing chemotherapy, and holding a patient's hand as they take their last breath. Cherish and respect these moments, and most importantly, learn from these moments. So as you leave here today, I ask you to do a few simple things. First, go into clerkship with clear eyes, a full and kind heart, a growth mindset, and a dedication to patient service, and you can't lose. And then do these 4 simple objectives. First, find your patients. Find who it is that you want to wake up every morning and care for. And for me, it's the 80-year-old woman with ovarian cancer who face lights up when she wants to talk about her grandchildren. Second, find the problems that you want to solve. What is it that makes you curious and want to get up each morning and learn more? Third, you should find your people. Who is it that you like to work with? If you're a morning person, surgery might be for you. If you're not a morning person, might not be the right choice. So find your people. And lastly, find your passion. So congratulations to the class of 2024 and welcome to the clerkship. Now here's Dean Zala for her closing remarks.
Thank you so much, Dr. Everett, for those thoughtful remarks. And wow, what an inspiring ceremony. For those of you who do not know me, my name is Dr. Krista Zala. I use she, her pronouns, and I'm the Senior Associate Dean for Medical Education here. And this is really what I love about my job. It is so important to acknowledge and celebrate milestones in your medical education, and especially for your class. This is so true for your foundation's curriculum, given everything that you have had to go through. You have spent the last 18 months developing a basic science framework that now you get to apply daily to patient care that begins with your core clerkships in March. And foundations hasn't been hard, according to Dr. Everett. That was the easy part. I mean, the foundations has been hard. I meant, according to Dr. Everett, it's been the easiest, but you've had a difficult schedule. You've had to deal with a constantly changing educational environment due to the pandemic. But trust me, your efforts, they will pay off. You will utilize your foundational knowledge every day with every patient to make important decisions about the medical care of your patients. So this is what's really exciting. And what I want you to remember is that you are an incredibly important part of the healthcare team. So if you ever lose sight of that, just remember, I am an important part of this team taking care of this patient. So again, I'm so proud of all of you. I'm really excited about all the different awards that were given out today. I want to thank Liz Dorman and her team who have put together this celebration, and thank you, of course, to Bruce and ComAV, who are always there to make our virtual events a success. But I also want to really say thank you to Dr. Karen Lansbury, the Director of Foundations and Preclinical Assessment. She and her team, that's the faculty, all the staff, and the senior students who acted as teaching assistants, really put so much effort into delivering the basic science curriculum during really challenging and constantly changing times. And most importantly, I want to thank all of you in the class of 2024 for your flexibility and your adaptability that you really navigated, as Dr. Rosen said, with incredible grace throughout foundations. So while your foundations experience may have been very different from prior classes, I am confident that you are all well prepared for the clinical environment. So in closing, I want to thank Dean Page, and again, congratulations to our faculty, staff, and student award recipients, but especially to all members of the class of 2024. For those of you who will be engaging in your clinical curriculum here in Vermont, I look forward to seeing you in the clinical environment and caring for patients together with you. And for those of you at other clinical affiliations, I really look forward to hearing about your experiences. So let's all stay connected. And as Dr. Rosen says, please continue to take care of each other, because that has truly been inspiring during these past couple of months of your foundation's curriculum. So thank you again, everyone, for joining us today, and congratulations.